IMPLA, the name for nearly 2 decades of research and development, practice and advances in osseous implantology. IMPLA, a step in a new dimension. The question may arise, why implants? A big advantage of implants is the effect they have on the alveolar bone. The implant loads and stimulates the bone much like the natural tooth does. The bone atrophies comparatively slower in the implant region, in contrast to the progressive bone atrophy without implants seen in the upper half of the picture. The denture can be attached securely to the jaw using only 2 implants as seen here on the model. The advantage for the patient: secure seating of the prosthesis. An excellent prosthodontic option is the use of implants to replace single lost teeth, even without the preparation of healthy abutment teeth. Implants, yes. The IMPLA BIT system makes it possible. The development of the BIT system began over 30 years ago when its predecessor, the IK screw from Lothar Kunt, was placed for the first time. At the same time, the first scientific articles from Lothar Kunt documenting osseous implantology appeared in the literature. Using finite element and photoelastic studies, the implants were constantly improved. The results of these developments? The IMPLA BIT system. The IMPLA BIT system can be reduced to one common denominator, 2 + 2. The system has only 2 implants, short and long, and 2 separate abutments, each in 3 different pre-angled versions, 0, 15 and 30 degrees. Above, the so-called soft connector for overdenture prostheses, below the compensating connector for crown and bridge techniques. Here the soft connector, in its 3 different angles, 0, 15 and 30 degrees. Here the compensating connector in its 3 different angles, 0, 15 and 30 degrees. The 3 pre-angled versions make it possible to compensate for all implant divergencies. All implants of the BIT system are manufactured from pure titanium, Conti-made 35. This highly biocompatible metal facilitates an optimum osseointegration. The rounded threads reduce local stress concentrations to a minimum, as clearly seen on the scanning electron microscopic view. To further enhance the osseointegration, the surface area is greatly increased by sandblasting it with aluminium oxide particles. The rounded base and the high-gloss polished neck facilitates optimum bone loading. The high-gloss polished neck facilitates optimal oral hygiene. The following series illustrates the surgical procedure for the BIT implant. Please note that a prerequisite for any implant must include a thorough clinical examination and treatment planning. Any possible medical and dental contraindications must be ruled out. The alveolar bone is exposed following a local incision and raising of a mucoperiosteal flap. The flap design depends on the clinical situation. A round drill is used to demarcate the implant site. The adjustable depth regulation sleeve is placed over the pilot drill and the previously determined depth correctly adjusted. The hole is drilled to the sleeve stop. The adjustable depth regulation sleeve is placed over the spade drill and the previously determined depth newly adjusted. The hole is drilled to the sleeve stop. The final hole is prepared without the depth sleeve, only as far as the drill stop. All BIT implants are supplied in sterile packaging, are gamma irradiated according to European standards, and are sealed. The seal is torn open and the outer package opened. The dentist carefully removes the implant out of its package without touching the implant. The implant is fixed into the prepared cavity with 1 or 2 left turns. The healing cap is removed from the implant in the silicone head. The dodecagonal screwdriver is used to slowly screw in the implant to its final position. Never use force to seat the implant. Please note that all BIT screw implants are threaded anti-clockwise into position. The implant is screwed into its final position. The healing screw is removed from the silicone head and temporarily fixed in the implant. The flap is replaced to its desired position and sutured. After 3 months in the lower jaw and 6 months in the upper jaw, the implant is exposed. The high-gloss polished neck facilitates optimal oral hygiene following healing and bone remodeling. The IMPLA BIT system and its unique advantages. A complete, compactly arranged system. Comprehensive, clear, suitable for beginners. With over 30 years of clinical research and development. 2+2. 2 implants and 2 abutments in 3 pre-angled versions provide the operator with maximum prosthetic opportunity. All BIT implants are supplied in sterile packaging, are gamma irradiated according to European standards, and are sealed. Continuing education courses in the subject of implantology are offered in national and international IMPLA training centres. IMPLA, implants to build on.